Well, across rural Minnesota, ambulance calls are up, but one call volunteers or on-call volunteers who operate them, that staffing level is down. It is considered a growing crisis in greater Minnesota, and today it was the subject of a town hall meeting in Mankato.
Fox 9's Rob Olson reports on the complex problem and the search for solutions.
It's a tragedy waiting to happen. It really is. It's a serious tragedy waiting to happen.
Rhonda Ingebretson is the ambulance director in Lake Crystal, southwest of Mankato, where they have one ambulance, and during the day, she runs it. The rest of the time is on call, and now she's covering more of that, too.
I'm also putting in 155 hours over the next 2 weeks because we don't have staff. We just don't have the staff to cover all those hours.
She shared her concerns at this town hall meeting in Mankato, addressing the very real concerns about the future of EMS service in rural Minnesota.
We just kind of started to realize, like, well, this whole thing is kind of broken. Like, EMS itself is having a hard time surviving.
Kelly Ash works for the Center for Rural Policy and Development and wrote this report about these complex problems, that as rural populations age, calls have gone up. For some services, more than double in the past couple decades. High enough to burn out the on-call volunteers, but not high enough to justify hiring full-time.
In the next couple years, if we don't make significant changes, we're going to start hearing more and more stories of people calling 911 and the ambulance either being super delayed or not showing up at all.
We transfer patients between hospitals more now than we ever did.
Another issue that is healthcare systems become more regional. The drives are farther, therefore more calls that take longer.
Urgent cares didn't pop up on every street corner in rural Minnesota. So the options for accessing health care are fewer and far between, and the ambulance service is most often the only transportation some people have.
The answers, as expressed at this town hall, are not simple. Increased state and federal funding, they agree, is crucial, as is pooling resources, as well as finding ways to attract more workers. Rhonda has lost 10 since last year.
COVID literally killed our service because it's killing our service.
Because it burned everybody out.
It burns everybody out. It's killing healthcare. It just burned everybody out.
In Mankato, Rob Olson, Fox 9.